5 minutes till we're live.
Hi, my name's Steve, and because I knew how to do CPR when I was at Parkrun, I was able to help restart a heart, and through what you're about to learn, you too could save a life.
Good afternoon, everyone. My name's Jo. I'm one of the paramedics here at Air Ambulance Charity, Kent-Surrey, Sussex.
Good afternoon, my name's Adam. I'm also one of the paramedics at Air Ambulance Charity, Kent-Surrey, Sussex.
On behalf of everyone at the charity, we really want to thank you for joining us today. It's quite a special day, National Restart a Heart Day. And we're really hoping to show you some skills on how you can save a life one day.
Now, you might only ever need to use these skills once, but you need to be ready for that moment because it could save someone's life.
And one of the key things we learn as clinicians as we go through our training programs is that it's really important to remain confident and calm. And that's what you can bring to situations where you need to perform CPR.
Now, we can't hear you, but at the end, or what we'd like you to do is type some questions into the chat, okay, and we'll answer them as we go along. What we'd like you to do now is have a really quick discussion amongst yourselves and with your teachers about why CPR is important and what we're trying to do before the ambulance arrives. And if you can put your questions in the chat to us now, we'll answer them as we go along. So why is CPR important? While you're thinking about those questions, we're just going to give you a few facts and figures about cardiac arrest and about CPR.
So your actions, if you came across somebody who has had an out-of-hospital cardiac arrest, can help people survive to discharge. We know from figures around the country that 1 in 10 people can survive to discharge from an out-of-hospital cardiac arrest.
Sadly, the chances of survival fall by 10% for every minute that CPR and defibrillation is delayed.
And also, we know that 80% of those cardiac arrests can happen in your own home or with people that you know, and sadly, that could be a friend or a family member.
Worldwide, other systems pave the way by achieving survival rates much higher than ours, and that's through good education, through public access defibrillators, and through CPR training. Hence the reason we're doing this today.
In the UK, there are around 30,000 cardiac arrests a year. So you really could play a part in saving somebody's life.
And as a charity, Air Ambulance Charity Kent-Surrey, Sussex attends roughly 300 cardiac arrests a year. Okay, so questions. Do we have some questions? Okay. If you do suffer an out-of-hospital cardiac arrest, you wouldn't have any chance of survival without good CPR. So it's really important even just to give it a go.
I think the other important thing to remember is that if you perform CPR as a bystander, you can always get people to come in and support you once that's in progress.
Okay. So hopefully you're all sitting in front of a screen in the classroom, in your office, and you've got some space around you. Okay. What we need you to do is grab a cushion, a rolled up jumper, a mannequin if you've even got one available. Okay. And we're going to give you a quick demonstration on how this works. We know there's a lot of people of different ages on this call, so we're going to try and tailor it to everybody and make it easy for you all to understand. Are you all ready to become lifesavers?
Before we move into that, we're just going to watch a short pre-filmed video and giving you some information about our charity at the Air Ambulance.
We're your local air ambulance charity. We hope you never need us, but every year thousands of people do. And if you do, we'll be there to fight for your life.
Our helicopters are flying emergency rooms. When there is a life or death call, we bring specialized doctors, paramedics and treatment to the scene fast. And we don't stop, 24/7, 365 days a year.
Last year, our crews responded to 9 incidents every day. That's over 3,000 incidents.
It costs $45,000 a day to run our life-saving service, making sure our team get to where they are urgently needed.
Without you, we can't keep flying. Without you, we can't save lives.
So we hope you found the video interesting. Let's get on with the CPR training.
So one of the things we need to establish is how we know somebody needs CPR.
One of the most important things and the first thing we should do is check for danger. We check for danger to ourselves and to the people around us.
I guess what dangers might there be, and that's something we need to think about before we do CPR and when we do it. The first thing, as you say, Adam, is to keep ourselves safe. We might see physical dangers, we might see electrical or chemical dangers that we come across that we need to be aware of.
If we're out in a public place, it could be the roads, it could be other people around us. So we need to make sure that we're safe and the people that we're looking after are safe as well. The next thing we need to do is have a look and recognise that this patient needs help or this person needs help. If they're not on their back, roll them onto their back. Place your hands on their shoulders and shout loudly, "Are you okay?"
Are you okay?
If there's no response, you need to get help straight away and call 999. Now, it could well be that they're not breathing or that their breathing is ineffective. Their breathing could be very noisy, it could be snoring, or they could be making long gasps, i.e. not regular breathing, in which case you need to call for help. We're going to move over now to a little video from one of our dispatchers, Lauren, who will explain the process of calling 999.
Hi, my name's Lauren. I'm one of the dispatchers for KSS. My job is to work in the 999 control centre and taking a look at all the calls that come in for Kent, Surrey and Sussex to help determine which call is best for the air ambulance to attend. When you call, the first question you're going to be asked is the patient breathing? Followed by, is the patient awake or conscious? So you're going to need to know your address. If you are somewhere rural or you're on a motorway, you're outdoors, then you might want to already have the What 3 Words app downloaded. This will give you 3 words that you can give to the call handler and they will be able to pinpoint your exact location. If you have small children or you've got younger siblings in the house, it's good to have them already prepped to know their address or to know where they can turn if they don't, such as to neighbours or to friends. You might also get asked about if there's a defibrillator nearby. The ambulance service is able to tell you where the local one is. They'll give you an address and they can also give you a code so that you can access it. If you've got someone on scene with you, you might want to have them waiting at the door to wave the crew down and to bring them in to the patient. If you're on your own, you will continue doing CPR until the crew arrive. The call taker will let you know when to go and open the door, and then you need to head straight back to the patient and carry on with CPR until the crew are in and next to you and ready to take over. If you have any pets on scene, then you may want to consider somewhere safe and out of the way to keep them whilst the crew arrive. So a quick recap on what we've discussed today. You're going to be asked if the patient's awake or breathing. You need to know your address or have your What 3 Words location to hand. You may also want to consider having your children prepped with their address or to know who they can turn to in an emergency. You may be asked to go and get a defib, but the ambulance service will give you all the details for that. If you've got someone on scene with you, you may want to get them to wave the crew down as they arrive. And if you're alone, wait for the person on the phone to tell you when to go and open the door. Finally, if you've got any pets, keep them safe and out of the way.
And thank you, Lauren, for highlighting really how important and how critical dispatch is during a cardiac arrest.
Okay, so we're going to move on to how to do CPR. So the first thing we need to do in this situation is kneel beside the person. I'm going to use the cushion here as for demonstration. We're not going to do mouth-to-mouth resuscitation. Okay, so one of the things that people often worry about is whether or not you need to do mouth-to-mouth. All we're concerned about is chest compressions, so don't worry about mouth-to-mouth here. Straight arms, interlock your hands. You're going to place the heel of the hand in the center of the person's chest, okay, and you're going to lean over using all of your body weight and press down as firmly and as as hard as you can in the centre of the chest. Easy way to remember how quickly you need to do it. People often sing to themselves, and you can use the tune to Staying Alive. Are you ready, Joe?
I'm ready.
Okay. Ready? 3, 2, 1. Ha, 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 ha. Staying alive, staying alive. Ha, 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 ha. Staying alive, staying alive. Okay. And that is it. It's really simple.
Because this is so critical, we're just going to give you another short demonstration. So as Adam said, we're going to reach our hands out in front of us, we're going to interlock our fingers, we're going to use the base of our hand, we're going to keep our arms nice and straight. We're going to move to the centre of the patient's chest, we're going to use our body weight and lean in and compress the chest. 1, 2, 3.
Ha, 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 ha. Staying alive, staying alive. Ha, 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 ha. Staying alive, staying alive. And that is it. It's really, really simple. Now, the next thing is defibrillation. This is the device that shocks the heart.
So a defibrillator you might find in various locations in the local community. One of the tasks for today actually will be to go home and find out where your local defibrillator is. It might be in your school, it may be in your office block, it may be at a leisure centre, it may be at a community church or places so. But the key thing is you know where it is. And they're also known as AEDs, and we're just going to give a short demonstration of how to use that AED.
They're very simple, and they give you numbered prompts to follow. So the first thing to do is to turn on the device.
Call emergency medical services now.
Okay. As per Lauren's video.
Mode. Follow the voice prompt calmly. Remove all clothing from chest and stomach. Rip clothing if necessary. Take out the pads from the bottom of the device. Tear open the pads packaging. Look closely at the picture on each pad. Peel off the pad labelled 1 and stick to the bare skin of the patient, exactly as shown in the picture. Peel off the pad labelled 2 and stick to the bare skin of the patient, exactly as shown in the picture. Do not touch the patient. Analysing heart rhythm. Shock advised. Stand clear.
Okay,
Press
clear.
the flashing orange button now. Shock delivered. Begin CPR now. Press the flashing blue I button for CPR. First.
Most of the modern defibrillators will actually give you that prompt, the metronome prompt, and that's the time with which you need to follow to do the chest compressions.
Breathe. System shutting down.
And it is as simple as that. Just follow the prompts on the device and it will tell you exactly what you need to do and when to do it.
Okay, thanks Adam for talking us through the defibrillator. I think now just a moment to recap and summarise what we've gone through. So, first step, check for danger.
So danger to ourselves, danger to the casualty and people around us.
And then we're going to have a look for a response.
So hands onto the chest. Are you okay? Can you hear me?
And at that time, we'll also be making sure that 999 has been phoned.
We need that help on the way. You're then going to start CPR. Remember, arms straight into the centre of the chest and depress the chest as firmly using your body weight as you can to that constant rhythm of the staying alive, or around about 100 to 120 compressions per minute.
And the next point, if you do have a defibrillator available, locate it and apply the defibrillator to the patient. So the next thing we have is a short story from Steve Harley. And Steve Harley was a son of a patient that we attended.
Hi everyone, my name's Steve, and I'm so glad that I knew how to perform CPR. When my father collapsed after walking his dog, My mum found him within only a few minutes and managed to call 999. Luckily enough, I only live a few doors down and managed to be there pretty quickly. When I saw my father unconscious and not breathing, I knew that I had to perform CPR. I managed to perform it and keep him alive until the crew from KSS arrived. Anyone can give CPR, it doesn't matter whether you're young, you're old, you're not going to hurt them and you're not going to make that situation any worse. You have the chance to save a life, so don't be scared or worried about doing CPR. KSS cared for my dad and he's made a great recovery, but if I had not been there, things could have turned out very differently. Just remember what you have learned about CPR today and the difference that you could make. You just never know when you might need it. So why not encourage others to learn about CPR? It's something that anyone can do. One day you might find yourself in the same situation as me with your loved one or your friend, and you have those skills to make a difference. Thank you for your support and spending time with KSS today.
Okay, great. So hopefully you've seen the video and it all kind of brings together what we've just talked about here. Okay, so we've got a number of questions in the chat and we're just going to go through some of them now. So first question, how long does it take to become an air ambulance crew member and what is the route?
Yeah, so there's many routes into the air ambulance. The first is that you'll have a professional clinical background. So you'll either come from a paramedic background or you'll have emergency medicine speciality or also anaesthetic background. But the key is once we've had that professional background, we'll move into a targeted training and tailored program so we can operate within an aviation environment and a clinical environment and do that safely. Generally, the exposure that a clinician would have from a paramedic background becomes around 5 years, but there is no set time on that.
Great. Next question. What are the stats for someone who doesn't receive CPR, as in for every minute they don't get CPR? So we know that for every minute that the patient doesn't receive bystander CPR, their chances of survival decrease by 10%. Okay, so it's quite staggering figures, really. So just by getting onto the chest, doing some CPR as quickly and as early as possible will increase, or hopefully increase, those chances of patients surviving.
Okay, the next question we've had coming in is, do you have to check for a pulse or just start CPR if you're not breathing? Great question. Something we often get asked. The key here is we just start CPR, so we just start compressions of the chest. So if you feel that when you assess that patient on a response that they're not breathing effectively, we will start that CPR. And there'll be people on the end of the phone that can help you support you through that.
Okay, next question, another great question. Any specific position for the patient? Ideally, you want them on a hard, firm surface, something that you can compress against. So if you ever have to call 999 in this situation, the call takers will give you instructions about trying to move the patient, particularly if you find them in bed, for example, or on the sofa, about dragging them onto the floor, getting them onto a hard surface so that you can do good quality chest compressions. Okay. Don't worry about hurting them at that stage. It's more important that you get them onto that hard surface to be able to do the good quality chest compressions.
The next question we've got coming in, is there an air ambulance national to the UK? So there are many air ambulances, many of them are charities like ourselves. We rely on you for our funding. And there are different services that can perform CPR. So we work very closely and have partnerships with the local ambulance services. We also work with private ambulance services and have a first responder scheme as well. And those sorts of things are key. What we're trying to do is to gain awareness or give awareness of how to perform CPR to actually teach people that chain of survival.
Next question, are there any specific instructions for patients with pacemakers? Okay, again, great question. In this situation, no. Okay, keep it nice and simple. The most important thing and the best thing you can do to give that patient a chance of survival is to do the chest compression, so don't worry about the pacemaker. If the pacemaker is doing its job and recognising that there is an underlying rhythm that's out of sequence, the pacemaker should do what it's supposed to do and kick in. But if it's not, then just doing the chest compressions is vitally important for the patient's chance of survival.
Yeah, thanks, Adam. So the next question we've got is with regards to defibrillator. and clothes being removed. Should we remove, say, a patient's bra, any metalwork, or things like that? So the key is to be able to remove the clothes best you can. If you do need to pull the bra to the side, fantastic. If you also need to just move any metal to the side, fantastic. As soon as you can get those defibrillator pads onto bare skin, that's where you're going to get the vectors through the heart so you can deliver that electricity. So what we're looking for is nothing to obstruct that electricity flow. So remove it best you can, don't get too worried about it.
Okay, next question. When would you perform rescue breaths, and if so, how many before start? So public awareness around CPR and defibrillation has completely gone away from now doing the need to do ventilation, the need to do rescue breaths. It's one of the things that often puts people off or makes people hesitant about performing CPR and resuscitation in the community. So we've completely sort of gone away from that and de-emphasized it, and the most important thing is just to do the chest compressions.
Okay, a couple more questions, and thank you for these. So the next one is, why are mannequins always male and any difference with females? So it's a really important question to address. Actually, we do have a variety of mannequins within our service that we can use. The key is with female anatomy, if there is breast tissue, we just move that to the side and then we apply the defibrillator pads for that. But in essence, the actual skill of performing CPR is the same. You're doing it to the same depth and the same rate.
Okay. Next question, similar to or around the rescue breath again. Should you tip the head back to open the airway? Again, in this environment, in the community environment, you don't need to worry too much about that. Okay, the most important thing, again, is just the chest compressions. So don't worry about the airway stuff at the moment.
Okay, I think this is the last actual question coming in. When should you not perform CPR? So the key is, I think, to take aim is if you do not feel safe or the environment is not safe to perform CPR, you should not perform CPR. But if you are happy to, you're willing to, you may perform CPR on strangers, people you don't know.
So just to kind of summarize everything, and from the patient, as you saw there, they wouldn't be here without CPR. So thank you for taking part today. Thank you for joining in, and we hope that you found it useful.
If you do have any further questions, we're going to pop a link up onto our screen now. Please contact us, community@aakss.org.uk, and we will happily get in touch with you.